I'm very happy to talk today, as Jobs mentioned, about the symptoms and manifestations of PCD. I will try to give an overview of the main symptoms and then go through some rarer symptoms towards the end of my presentation. Amelia already presented very well, so I will not stay on that. That cilia can be found in many places in the body. That means that PCD can lead to many different symptoms. So not every person with PCD will have exactly the same problems necessarily. In the respiratory system, since the cilia do not move properly, we have difficulty to clear the mucus from the lungs, but also from the nose and sinuses to the throat. And that leads to almost all people with PCD having some types of problems from the airways. These problems often start very early in life, soon after birth, and this poor clearance of mucus leads to the mucus being accumulated in the airways and often gets stuck there. That leads to recurrent infections, and in order, that can lead to chronic problems and chronic inflammation in the airways. So over time, we usually see functional and structural changes in the airways because of PCD. Let's break it down to the different organ systems. So what happens in the upper airways, specifically in the nose and the sinuses? These graphs that I'm showing you, they are from the BEAT-PCD study that Jobs mentioned. This is a clinical cohort with children and adults with PCD in 10 countries, in 13 centers. And we can see here that both children and adults with PCD in blue and in orange on the left graph, they report having chronic symptoms from the nose. And in blue are the people who report having these symptoms daily or many times a week, so very often. These are usually blocked nose or runny nose, and particularly in adults, more than 20% of the people report also having problems with the sense of smell, a condition that is called anosmia. So in the nose and the sinuses, the repeated infections lead to development of chronic inflammation and a condition that is called chronic rhinosinusitis, meaning that people have symptoms also outside of acute infections. The lower graphs show findings of examinations from the ENT specialist during follow-up visits, so outside of acute infections. We can see that many people with PCD, again, both children and adults, have signs of inflammation that would be redness or swelling. And this swelling also explains the feeling of the blocked nose, even when the person does not have an infection. People with PCD often also have nasal polyps, especially adults, up to 20%. And at examination, they might have facial pain, which is in the areas of the sinuses, which is an indication of a chronic inflammation, again, even when they don't have an acute infection. What happened in the ears? In the ears, in a similar way, we also have repeated infections and episodes of otitis, especially in children. With age, usually these acute infections improve, and in adulthood, they become less. However, the problems develop in a more chronic way. So in the graph on the left, we can see how frequently people from the BEAT-PCD study report problems from the ears. And we see that adults actually report more frequently ear pain and especially hearing problems, particularly adults over the age of 30 and 50 years old. At examination, the most common finding is a condition that is called glue ear, where we have the accumulation of sticky fluid behind the tympanic membrane that is also usually the reason for a hearing problem or even for pain outside of infections. In adults, it's quite interesting that we see less glue ear. However, we see frequently signs of tympanic sclerosis. This is a sign that the tympanic membrane has gone through too much in the past. So it's a sign of many infections in the past, much scarring. So usually that the problems have become chronic. In the lungs, we again have, due to the poor clearance of the mucus, repeated infections, and this developed in almost all people with PCD at some stage in chronic wet cough. These graphs are results from people with PCD living in Switzerland, data from the Swiss PCD registry. And we can see here in children and adults how frequently people report having cough. So we see that almost all people report having wet cough and sputum production, and usually frequently, but at least sometimes. And then with the passage of times and as the lungs get more damaged, people start also developing shortness of breath. So although not many children will have frequent shortness of breath, we see that more than 20% of the adults in the Swiss PCD registry report having either daily or many times a week shortness of breath. To get a better indication how that changes with age, you can look at the graph on the right. Here we see people of different ages participating in the registry and how frequently they report cough, which are the blue dots, every person is a dot, or shortness of breath, which are the orange dots. And we can see that most of the people, regardless of age, report daily or often cough, which are the blue dots concentrating on the top of the graph. However, with shortness of breath, the situation is different. Most children, the dots are concentrated on the bottom, so never or rarely they would report shortness of breath. In the older people, this situation started to change, and we see that this is distributed. And yes, some of them might not have shortness of breath, but many of them report it more frequently. And then we also have some adults that report it daily. So what it happens in the lungs is this vicious circle of infections that lead to further inflammation, and that leads to tissue damage with the development of bronchiectasis, where you can see in this figure the airways do not look anymore as a normal airway, but they are more widened and damaged, and that leads to further accumulation of mucus, which in turn leads to further infections, further inflammation, and this is the circle that I just mentioned. And this, of course, also with time leads to also lung function decline. Outside of the airways, the cilia are responsible for the final position of organs during the fetal period. That means that people with PCD might have different variations for the position of their organs. 40 to 50% of people will have a condition that is called situs inversus totalis, and you can see that in the top line of the graphs in the middle, where all the organs will be a mirror image of the organs of a person without situs abnormalities. In a smaller percent, 10 to 15% of people, you might also see differences in the final position of the organs. So usually the heart remains structurally normal, and many times this might not give any symptoms. So we need to check with an ultrasound to find the final position of the organs. But sometimes also other organs might have problems, like a person might not have a spleen or might have multiple small spleens. And in some cases, even the intestines might be malrotated, so twisted. The heart is something that it's very important for us to check early in life, because in few people, this situation can be associated with a heart defect. About 5% of people with PCD might have a heart defect that often is simple and easy to deal with. But in very rare occasions, there also can be severe congenital heart disease, which of course contributes to mortality. So I will say again, it is very important to assess that earlier in life with an ultrasound. Cilia can be found in the reproductive system of men and women with PCD. In men, the tail of the sperm has a very similar structure with the cilia. So in men that have some specific genetic mutations that cause PCD might have a sperm that has affected the ability to move. Not all genetic mutations will cause these problems. Also, even for people who have a mutation that affects the sperm, Some genes would lead to sperm that doesn't move at all. Others would lead to sperm that moves but with difficulty, and others might lead to low sperm count. In women, the information that we have so far is a bit less clear. There is less data, and it's quite difficult to test the fertility status of women. Many women with PCD can have children naturally, while others, we know that they struggle with their fertility. Also, a recent study has shown that women with PCD have an increased risk for ectopic pregnancies. So for a pregnancy that it's not as normally expected in uterus compared to the general population. So it is important for pregnant women to check with their gynecologist very early in the pregnancy that the fetus is in the uterus. It's also important to remember that all people with PCD have other problems outside of their PCD, as every person has, and they might struggle with other factors related to fertility. That's why it's quite important to know, and especially if they want to have a family, early on about potential fertility problems and try to take measures to deal with them. So these are data from the Living with PCD study, an international online participatory study with adults and children with PCD. And these are information from women and men, adult women and men who participated in the study and their fertility status. On the bottom in darker blue, we can see the people who managed to have naturally pregnancy and have a child. And then in lighter blue, we can see the people that they managed to achieve a pregnancy with fertility treatments. While with the pink and darker pink color, we see the people who did not manage to achieve a pregnancy despite ongoing fertility treatments, or the people who did not manage but they didn't get any treatments. The important thing to remember here is that 3/4 of the women and more than half of the men with PCD managed to conceive a child, either naturally or after following fertility treatments. So people with PCD who want to have a family have a lot of chances to achieve that, possibly even more than they study if they know their status early on and get appropriate treatment. And I want to briefly touch on some rarer manifestations. These are not common in people with PCD, but in some people, PCD can coexist with some other ciliopathies, so mutations that affect the non-motile cilia. So that might mean that they might have a condition also that is called retinitis pigmentosa that affects the eyes and leads to gradual loss of vision. In rare occasions, some people might have cysts in the kidneys or a situation that it's called hydrocephalus, with liquid being accumulated in the brain that can lead sometimes in mental retardation, as well as loss of smell, which is direct from the non-motile cilia not working, and it's not caused with the same mechanism as I mentioned earlier with the people who have chronic rhinosinusitis. I want to briefly say a few things about mental health. Although this is not a physical symptom, we know that all chronic conditions, and that also includes PCD, can affect emotional health and social functioning. So this is a study from the Netherlands in adults with PCD, and it has shown that about half of the adults have reported mild to severe psychological symptoms. There are many different factors specifically for PCD that can contribute to impaired mental health. For example, the diagnosis is often delayed. That has been improved a lot in children nowadays, especially in countries with centralized care. But it's not the case for a lot of the adults who took many years to be diagnosed. Also, a lot of people, sometimes they feel embarrassment in public settings due to their symptoms or to the need to clear frequently the mucus. And of course, it is a big problem, the lack, so far at least, of cure, and the fact that many treatments are not evidence-based, and that causes some insecurities and worries in people with PCD. Lastly, a lot of people, not everyone, but a lot of people with PCD need to undergo quite extensive treatments, a lot of hours of physiotherapy, and that treatment burden, together with having to organize their care, many times contributes to impaired mental health. So the quality of life of people with PCD is often impaired by the wide range of symptoms. And unfortunately, it has not been easy so far to capture it with existing quality of life scores from other diseases. So now we have a PCD specific score. And so another issue is that people with PCD often they get used of their daily chronic symptoms and they think this is normal. And then there are other additional factors. I mentioned treatment burden, but also in many countries, the lack of centralized care and the lack of awareness among non-specialist physicians that impairs further the quality of life of people with PCD. To summarize this presentation, we need to keep in mind that PCD manifests in a wide range of ways. Not every person will have the same problems and the same needs. And the severity of symptoms can differ not only with age, as I said, sometimes the symptoms get more serious with age, but also between people of similar age. And Professor Claire Hogg will give a presentation on that in the next session. And many times people with PCD get so used to living with their daily symptoms that tend to underestimate how much they can affect them. So it is important to have regular follow-ups so that your clinicians can study how the disease progresses in each person specifically. And although we do not have yet at the moment a cure for PCD, the commonly used treatments, they focus on managing the symptoms in order to improve daily life and delay disease progression. Thank you very much, and especially thanks to all the people with PCD who participated in the studies I mentioned and help us understand more about the disease.